Okay, cool. So if you missed it earlier, my name's Erica, and I'm one of the tutors for PCC this semester. So we're going to go ahead and start with some practice questions. I would really like if you guys could drop your answers in the chat to let me know kind of where you guys are at, what you guys are thinking. Don't ever feel bad for having a wrong answer. So yeah, let's go ahead and get started. Let me know if you guys have any issues with seeing the slides or anything. Because I'm just getting used to the Teams. But the first question we have is, which of the following is true regarding the use of restraints? Select all that apply. So A, the nurse should be able to slide 2 fingers under the restraint. B, tie restraints to the side rails. C, use a quick release knot. D, restraint should be released every 2 hours to assess circulation. And E, restraint prescriptions must be renewed every 48 hours. And this is a select all question.
Hi, Erica. We're not
Yeah.
able to chat. I'm not able to chat at least.
Oh no. Okay. I wonder if I can open the chat somehow. Let me take a look at that real quick. Okay, do you guys feel comfortable like maybe saying out the answers? What do you think? Or I can just go over them. Either way is fine. So for this one though, the answer is going to be A, C, and so A, the nurse is going to need to be able to slide 2 fingers under the restraint. This is really important to make sure that the patient doesn't lose circulation. And it needs to be 2 fingers also so that it's tight enough. So it's not going to be B because we never tie anything to the side rails ever. So you're going to want to tie the restraints to a movable part of the bed. We would, yes, use a quick release knot. That way you can get the restraints off easily if you need to. And yes, also D, they should be released every 2 hours to assess circulation and do those passive range of motion exercises because you are restricting their ability to move a lot of times on their hands. And then E, restraint prescriptions must be renewed every 48 hours. This is false because they need to be renewed every 24 hours. Restraint prescriptions are one of like the most strict prescriptions to have. It can't be a written prescription or a PRN prescription because this is like our last resort. So if a nurse is putting restraints on the patient, it's because they've tried every single other method before that because they aren't something that we usually want to use. And you do always need to renew the prescription every 24 hours, no matter what, because the doctor needs to reevaluate that the patient still needs the restraints. So the next question, a patient's hemoglobin saturation via pulse oximetry indicates inadequate oxygenation. What should the nurse do first? A, notify the primary health provider. B, encourage deep breathing. C, raise the head of the bed. Or D, provide oxygen. And this is going to be what should they do first? So the answer to this one is going to be C, raise the head of the bed. So we're going to do this first because if we can only do one thing, what is it going to be? It's going to be to raise the head of the bed. We would want to do all these other things as well, notifying the provider if it is a severe number. Obviously, encouraging deep breathing would be good, having them take slow breaths so they're not hyperventilating. And then obviously we would provide oxygen as well if the level was low enough to require it. But the first thing we would do is raise the head of the bed, just to help them breathe better. So the next question is, an infection acquired in a hospital setting after being admitted is called A, iatrogenic, B, direct, C, non-communicable, or D, nosocomial. Sorry, I'm kind of also looking at the same time to see if we can get the chat working. If anybody happens to know, send me an email. Okay, so the answer to this question is going to be D, nosocomial. So a nosocomial infection is a healthcare acquired infection. These are going to be things like C. diff, and MRSA is another common one, things that you're likely to get because you're in the hospital and you might not necessarily get outside of the hospital, because these things do spread very easily. And when the same nurse is going in and out of the room, of multiple patients' rooms, infections can spread really quickly. So that's why it's important to really be good about our PPE and our infection precautions. A non-communicable disease would be one that can't be spread. And then a direct infection would be one that you got directly from the source. So someone coughs, that's going to be like direct. Another infection you can get in the healthcare as well is going to be something like a CAUTI, or so a UTI that is caused by having a Foley catheter. That's also a common infection in the healthcare setting, and a reason why we try and prevent using those. All right, so the next question is, which interventions can the nurse include in the plan of care to reduce a client's feelings of isolation related to being on transmission-based precautions? Select all that apply. A, allow electronics in their room. B, assign a roommate to their room. C, schedule time to spend with the patient. D, instruct family members on transmission-based precautions to allow visits. And E, take the client for a walk around the unit. And this is a select all. All right, so the answer to this one is going to be A, C, and D. So A, we would want to allow electronics in their room. They're usually always allowed those in their room. But another thing we want to always do is keep their belongings at their bedside. So that's something you might see in some questions, to make sure they have their belongings within reach. You would not assign a roommate to their room because they are on transmission precaution. So that means they have an infection that could be spread. So we never assign roommates. They actually need, if they have a roommate, they need to be moved. We would schedule time maybe to spend with that patient. Hey, maybe I could come in here and spend a few minutes with you after you eat your lunch or something. And that way the patient can just feel not so isolated and alone because they are stuck in their room. We can instruct family members on transmission-based precautions to visit. They can visit with any transmission precaution. Even the airborne precautions, they are allowed to visit as long as they know the precautions and are wearing the right PPE. And then we would not take the client for a walk around the unit because they have an infection that can be spread. So this one is A, C, and D. The next question is, which oxygen level system would you use for the lowest flow of oxygen? A, a non-rebreather mask. B, a face tent. C, a nasal cannula, or D, a Venturi mask? So the answer to this one is going to be C, the nasal cannula. So for the lowest amount of oxygen, the nasal cannula can give 1 to 6 liters of oxygen, and 6 is the most that you can give through that nasal cannula. The others can give a lot more, or liters at a time. I'm just going to pull up because I don't want to give you any wrong information. So the non-rebreather mask, that's going to be the only mask that can deliver that 100% FiO2. So that's going to be the one that can give us our highest concentration. The face tent, that's kind of similar to the face mask. Sometimes we'll use the face tent if a patient is having difficulty with one of the other types of masks, or if they're getting kind of like claustrophobic from using the actual face mask. And then the Venturi mask, that's what we use when we need a precise oxygen concentration, because this one can be precisely controlled. But for the lowest flow, we will use the nasal cannula. Which nursing intervention is appropriate for preventing atelectasis in the postoperative patient? A, an incentive spirometer, B, chest percussion, C, postural drainage, or D, suctioning. Okay, so the answer to this one is going to be A, the incentive spirometer. So to prevent atelectasis, we want to be expanding the lungs, because atelectasis is the collapse of the alveoli, which are those big sacs at the bottom that is where the exchange of the gas occurs. So we want to use the incentive spirometer. That's that little device that the patient will breathe in as much as they can through. And that'll help to open those alveoli and prevent them from collapsing when they're not able to move. So atelectasis is one of those complications of immobility. Chest percussion, postural drainage, and suctioning are all going to be more so interventions to prevent maybe pneumonia. So when there's fluid in the lungs, we want to do that postural drainage and chest percussion. That's going to be when we put them in that Trendelenburg position. And then you'll use some vibration on their back. And that's usually done by the respiratory therapist. And then suctioning is done as needed to clear the airway. A nurse is caring for a client who is sitting in a chair and asked to return to bed. Which of the following actions is the nurse's priority at this time? A, obtain a walker for the client to use to transfer back to bed. B, call for additional staff to assist with the transfer. C, use a transfer belt and assist the client back into bed. And D, determine the client's ability to help with the transfer. This is going to be a big one for priority question, because a lot of these answers could kind of be good ones. So the answer to this one's going to be B. So we would want to call for additional staff to help assist us with the transfer. A and B, or A and C, are kind of the ones that could maybe throw us off a little bit. We could definitely use a walker or a transfer belt to help get them back to bed. But we do want to always call for additional staff to help with assist to prevent falls, but also to prevent injuries to ourselves, depending on how mobile the patient is. So we would want to call for the additional staff. Next question is, the nurse has an order to apply oxygen at 100% FiO2. Which mask would the nurse apply for this concentration? A, a simple mask. B, room air. C, non-rebreather mask. And D, Venturi mask. So for this one, the answer is going to be C, the non-rebreather mask. The non-rebreather mask is the one that we can give the greatest amount with. The simple mask is going to give 5 to 10 liters at 40 to 60%. And room air is just they're breathing the regular air. I definitely fell victim to thinking that room air meant something else, but it is just, they're just breathing the regular air. That's all it means. So we would use the non-rebreather. A diabetic patient presents to the clinic for a dressing change. The wound is located on the right foot and has purulent yellow drainage. Which action will the nurse take to prevent the spread of infection? A, position the patient comfortably on the stretcher. B, explain the procedure for a dressing change to the patient. C, review the medication list that the patient brought from home. And D, don gloves and other appropriate personal protective equipment. So the answer to this one is D. We would want to don gloves and other appropriate PPE to prevent the spread of infection. So when we look at this question, we're kind of wanting to look at what it's asking us, which is what is the action to prevent the spread of infection specifically? So we would want to position the patient comfortably, but that's not going to prevent infection from spreading. We would want to explain the procedure for dressing change, but that's not necessarily preventing infection spread. And then reviewing the med list that the patient brought home, also very important. That's our medication reconciliation, but that also not really related to infection. So D is going to be our best answer. We always want to wear gloves and our PPE when we're doing things like dressing changes, especially. The nurse is caring for a patient on contact precautions. Which action will be most appropriate to prevent the spread of disease? A, place the patient in a room with negative airflow. B, wear a gown, gloves, face mask, and goggles for interactions with the patient. C, use a dedicated blood pressure cuff that stays in the room and is used only for that patient. Or D, transport the patient safely and quickly when going to the radiology department. So the answer to this one's going to be C. We always use dedicated blood pressure cuffs for really all of our patients. Actually, they all have one that stays in their room and that's disposable. But this is a really important way to prevent the spread of disease. We also give everyone their own pulse ox for their finger because that way we're not reusing things that's been on people's skin. Did you have a question, Delaney? Go ahead.
Question. Why is it not B?
Okay, so wearing a gown, gloves, face mask, and goggles. So contact precautions, we only really need to wear gloves, maybe a gown as well if you're going to be doing something within that intimate space. But you don't need to wear a face mask on contact precautions, and you don't need to wear goggles on contact precautions either. So that's why that one would be wrong.
Okay, thank you very much.
You're welcome. That's a really good question. It's actually funny because last year when I took this class, it was more towards COVID time and we were like, what? No face mask? But you only need the face mask in within 3 feet of the patient on droplet precautions. And then obviously you have that N95 respirator with an airborne precaution, but you don't need to wear them for contact precautions. However, depending on the contact precaution, you probably would want to. So yeah, we'll use that dedicated blood pressure cuff. So the next question is, a patient who complains of difficulty breathing should be placed in which of the following positions? A, Fowler's, B, lateral, C, supine, and D, prone. So we kind of talked about this one yesterday too. I've touched on it a few times because it will come up over and over, but it's going to be A, Fowler's position. That's going to be with the head of the bed up. So anytime that someone's having trouble breathing, we raise the head of the bed to prevent them from aspirating and just to be able to give their lungs the most room to expand. The lateral position, that's going to be with them on their side. The prone position is going to be on their stomach, and the supine is flat on their back. A client who has a cerebral vascular accident has persistent problems with dysphagia, which is difficulty swallowing. The nurse caring for the client should initiate a referral with which of the following members of the interprofessional care team? A social worker, B, a certified nursing assistant, C, an occupational therapist, or D, a speech language pathologist. So the answer to this one is D, the speech language pathologist. Our SLPs are really great, and they have a lot of knowledge regarding swallowing and feeding. So the SLPs will be really helpful in pediatrics as well with babies learning how to breastfeed and feed from the bottle because they're really experts with that. The occupational therapists help clients to regain activities of daily living like walking and riding, brushing their hair, those kind of activities. The certified nursing assistant is there to help the nurse. So they're going to be doing things like turns and vital signs. And then the social worker, that's somebody that we would refer out to if the patient is in need of maybe some support groups or financial support, or maybe they don't have insurance or something like that, or a housing issue. That's when we would refer out to the social worker. And as the nurse, you have the ability to make these referrals. And this is how you can really act as a patient advocate as a nurse, is by making these referrals and noticing that your patient needs an interprofessional care team with, maybe some more members. Which of the following is the best goal for a patient with ineffective airway clearance? A, the nurse will teach the patient about pursed lip breathing. B, the patient is supposed to say oxygen saturation will go from 89% to 92%. The patient will have improved breathing before discharge. And D, the patient will state that they are breathing better by the end of the shift. So for this one, the best goal is going to be D, the patient will state that they are breathing better by the end of the shift. So A, the nurse will teach the patient about pursed lip breathing. That's not a goal as much as it is a nursing intervention. The patient's oxygen saturation will go from 89 to 92%. There is no time frame on this goal. So that's why that wouldn't be the best choice. C, the patient will have improved breathing before discharge. Improved breathing isn't something we can compare anything to. Improved how? How are we going to evaluate that? And then D, the patient will state that they are breathing better by the end of the shift. That's our best choice. Yes, if you have a question, you can go ahead and ask.
Okay, so we had this question in lecture, and I just kind of wanted to confirm too. So you said B is more so because it doesn't have end time, like before discharge or by the end of shift. So would that kind of be like an indication in just other questions as far as the best goal? It needs to have a time frame, I guess is what I'm asking.
That's a really great question. So any goal we want to be a SMART goal. I don't know if your guys' teacher talked to you about that. SMART goals are specific, measurable, achievable or attainable, realistic, and timely. So with every goal, it needs to be specific. Improved breathing is not specific. It's also not measurable. So that's why C is not the answer. It needs to be attainable. So if we have a patient with COPD, we shouldn't say their oxygenation will go from 89% to 100%, because we're not going to have that with a patient with COPD. That's not attainable. And then it always needs to be within a time frame, because otherwise, when will we know when we met the goal, or when will we know the goal is achieved, and how can we evaluate that? So the nursing process isn't in this first exam, but this kind of ties in with the nursing process in that you need to be able to evaluate the outcomes. And with B, when are we going to evaluate that? It's left out. Go ahead, Alexis, if you have a question.
So if the nursing process isn't involved in this, exam 1 is just modules 1 and 2, right? Because I know you said 1 and 3.
It's going to be 1, 2, and 3. So it does include, but it doesn't include the nursing process as far as I see in the blueprint. But module 3, I'm going by like the Canvas headings. So when I say modules 1 through 3, that's what I'm referring to. That's going to be patient education. I think I can pull it up here real quick. But this is a question that you could see on the test, because it's going to have to do with the oxygenation of the patient and like the goals. But if you guys haven't gone over it, might not be. Okay, but module 3 is patient education, documentation, and culture. So yeah, that's that one. What is the main difference between ventilation and respiration? A, respiration involves gas exchange from the alveoli to the capillary system. B, respiration is mostly about air movement. D, ventilation is mostly about gas exchange. And D, respiration involves lung pressure. The answer for this one is A, respiration involves gas exchange from the alveoli to the capillary system. So ventilation is that mechanical movement of the air in and out of the lungs. So for B, that would be ventilation is mostly about air movement, and C should be respiration is mostly about gas exchange. And then D, respiration involves lung pressure, is kind of just an erroneous answer. But it's very important to understand the difference between these two, because this is definitely something that gets tested on. So make sure you know that one. Which criteria must be present for an occurrence to be labeled a never event? Select all that apply. A, documentable. B, preventable. C, manageable outcomes. D, serious. And E, measurable. So the answer for this is going to be B, D, and E. Never events are preventable, they are serious, and they are measurable. Never events are things that should never happen. An example would be if you're performing the surgery and you do it on the wrong part of the body or on the wrong patient, or you leave something in the patient, or you let somebody take a baby home that's not theirs. Those are never events. They should never happen. They're 100% preventable. They're very serious and could have detrimental outcomes. And we can also measure them because they need to be prevented. And I'm not sure if you discussed this, but you'll do like something called a root cause analysis to go over what could be done to have prevented that from happening. And the institution will usually make some changes after. A nurse is teaching an assistive personnel about proper hand hygiene. Which statement from the assistive personnel indicates understanding? A, there are times I should use soap and water instead of alcohol-based sanitizer. B, I will use cold water when I wash my hands to protect my skin from becoming too dry. C, I will apply friction for at least 10 seconds while washing my hands. And D, after washing my hands, I will dry them from the elbows down. So the answer to this one is A. There are times I should use soap and water instead of alcohol-based sanitizer. So there's a good balance for nurses between using hand washing and alcohol-based sanitizer. Times we want to use water and soap is if your hands are visibly soiled, when you arrive on the unit, when you leave the unit, after you eat lunch. So those are times when soap and water is better. or if you were maybe in a room that had transmission-based precautions is another time you might want to wash your hands with soap and water. But when you're changing gloves, for example, you would want to use an alcohol-based sanitizer. Otherwise, we will be washing our hands all day long. And so B is not right because we use warm water. C, we're going to want to do friction for at least 20 seconds when washing our hands. And D, we always want to dry from the hands down. Because those are like the cleanest part to like the not cleanest part. Number 18. Which behaviors should the nurse include when actively listening to a client? Select all that apply. A, look at their watch. B, focus on nonverbal behaviors. C, face the client and lean in. D, type in the medical record when speaking. And E, sit at eye level with the client. So the answer to this one is B, C, and E. We want to focus on nonverbal behaviors. So you want to be aware both of your body language and the client's body language. Tone of voice, for example. We want to face the client and lean in to show that we're engaged in the conversation. If we're standing on the side with our arms crossed, they're not going to feel like they're being necessarily heard. D, we don't want to type in the medical record when we're speaking because then the patient thinks that you're not listening to them. Making that eye contact really makes a difference. Looking them in the eye when you're talking to them. And then, so yeah, E, sitting at eye level with the client. When you sit down with the client, it kind of shows them that you are saying, I have the time. I have the time to listen. I have the time to spend with you. And also so that they don't feel like someone's standing towering above them. Because a lot of times they're going to be in the hospital bed. Which is an effective nursing action for preventing falls? A, requiring family to remain with the client. B, application of restraints. C, use of a bed alarm. And D, administration of sedation. So for this one, preventing falls, we want to use a bed alarm. So the bed alarm, you turn this on down at the end of the bed. There's like the little plastic thing that you'll flip up and you can turn the bed alarm on and it'll go off when the patient gets out of bed. So a patient that's at high risk for falls, we want to put that bed alarm on and it will ring and alert this really obnoxious noise throughout the unit. You can also put a chair alarm on the chair. So if they're sitting in the reclining chair next to their bed, you can also do a chair alarm to prevent them from getting up. We wouldn't require family to remain with the client. We can't require that. We wouldn't want to apply restraints. Again, restraints are going to be our last resort. You want to try everything else, and you also need to document that you tried everything else before you put them in restraints, because clients and patients have rights to not be restrained against their, not against their will, but against necessity, of course. So we always want to document that we tried everything before. But if, of course, if things keep happening, they keep getting out of bed, that could be a possibility with a prescription. And then administering sedation. Sedation is actually going to be a risk factor for falls because it's going to make them uneasy on their feet. So if anything, we would want to prevent administering something that's going to be a sedative for someone who's at risk for falls. The nurse is speaking with a colleague and says, I feel like meeting the client's fears, cultural needs, and family needs is just as important as taking care of their physical needs. What theory is this statement supporting? A, the holistic nursing care. B, honoring personhood. C, transpersonal caring moments. And D, personal presence. So the answer to this one is A, holistic nursing care. So holistic nursing care is the idea that we're not just caring for the patient's disease, but that a lot more of their life kind of factors into their disease. What are they do on a daily basis, and what are their values. And those things can really help our patients just as much as helping them physically, because sometimes those physical things are caused by some like emotional or cultural issues. So honoring personhood, transpersonal caring moments, and personal presence are, I don't even know what those are. So those are just not the answer. And they won't be the answer. That's kind of one of those ones you can say, okay, never heard of that, probably not the answer. What are the characteristics of therapeutic communication? Select all that apply. A, empathy. B, sympathy. C, respect. D, non-confrontation. And E, genuineness. So for this one, the answer is going to be A, C, and E, empathy, respect, and genuineness. Nurses need to be empathetic, and showing empathy can be done by being with the patient. Those things like being with, knowing, doing for, caring, those are all, characteristics of like empathy. We never want to show our patients sympathy. That is never going to be the answer. Respect, of course, we want to give them respect so they'll respect us back. D, non-confrontation. So this one might be a little bit tricky, but it's actually not going to be D, because we do have to sometimes confront our patients with things that they maybe not want to talk about. Things like end of life or really hard decisions, bad news. So we do have to be the ones to confront them. Or if maybe their lifestyle isn't helping them, we need to say, hey, you do have a problem and here's how we can solve it. But you do sometimes have to be confrontational as a nurse. And then, of course, genuineness. Those core beliefs for the nurses, we have the beneficence, the non-maleficence, veracity, fidelity, and genuineness is kind of one of those with being loyal and honest to our patients. We never want to give them that false reassurance or lie to them about anything. We want to be honest. A patient is admitted with severe pneumonia. Which of the following assessment findings would indicate that the patient needs airway suctioning? A, coughing up thick sputum only occasionally. B, coughing up thin watery sputum easily after nebulization. C, decreased independent ability to cough. And D, lung sounds clear only after coughing. So the answer for this one is C, a decreased independent ability to cough. If the patient's not able to cough up their secretions, they're still having those secretions. So that's when we need to suction them. This is also when you might do the postural drainage and chest physiotherapy if they're having that inability to cough, but they are having, this patient has severe pneumonia. If they're coughing up thick sputum occasionally, that's good. They're coughing it up. They're coughing up thin watery sputum after the nebulizer. That means the nebulizer worked, so that's good. And then lung sounds clear only after coughing. That's fine. The patient has pneumonia. They're going to have some extra lung sounds because of the fluid. A client has been put on oxygen therapy because of low oxygen saturation levels in the blood. What should the nurse use to regulate the amount of oxygen delivered to the client? A, a pulse oximeter. B, a flow meter. C, the nasal strip. Or D, an oxygen analyzer. So for this one, the answer is going to be B, the flow meter. So the flow meter is that little green thing that you're going to plug into the wall, and it has a little clear tube with all the little numbers on it, and at the bottom it has a little triangle, and that's where you're going to hook up the oxygen tubing to. You guys have probably done that in the lab, but the flow meter is that machine that plugs into the wall on the green port, And that's where you turn the little dial, and then the ball will go up to the amount of oxygen liters. And you want the ball to be in the middle of the bar for how many liters. And also important, oxygen is considered a medication. So we, for example, in first semester, you cannot ever give oxygen. You can't plug the oxygen in. Don't ever mess with the oxygen, because that is considered a medication because it has to be prescribed by the physician. So we can administer oxygen in an emergency situation. The nurse can if there's not a prescription, but it will be important to know that you don't want to change the flow meter unless you do have a prescription. A research-based method for judging and choosing nursing interventions is referred to as what? A, evidence-based practice, B, multidisciplinary practice, C, a collaborative problem, and D, nursing practice. So the answer to this is going to be A, evidence-based practice. So what evidence-based practice is? It is a research-based method for choosing what the best thing to do for our client is. So evidence-based practice is going and taking all the research from peer-reviewed journals and clinical trials, randomized control studies, and using that knowledge in addition to clinical knowledge and our patient's own personal clinical picture, and then using that to judge and choose nursing interventions. So very important. And evidence-based practice is something that nurses can use and implement into their practice. But it's not used by all nurses or all healthcare professions. So that is important to note, because I didn't know that when I learned about it. So on your exam, I saw that there's going to be a matching question and an ordering question. So I threw these in here at the end. I'm going to also include some in the next review, just so you guys have an idea of maybe what he might ask or what might be on the test for these. So correct me if I'm wrong, if you guys don't, but I did see that on the blueprint. So for this one, it says match the following stages of the therapeutic relationship with their correct definition. So the 4 phases: termination phase, pre-interaction phase, working phase, and orientation phase. And then the 4 definitions: gathering information prior to meeting the client and establishing rapport, the active part of the relationship, and the conclusion of the relationship. So the first step of the therapeutic relationship is the pre-interaction phase, which is going to be gathering that information prior to meeting the client. And then we're going to have the D, the orientation phase, and that's going to be meeting the client and establishing that rapport. And then for C, the working phase of the relationship, that is the active part of the relationship. And that's when the client is going to be communicating with the nurse through verbal and nonverbal communication. We had a question about that in yesterday's review. And then the conclusion of the relationship, that's going to be the termination phase. So when it comes to matching, typically it'll be like a definition kind of situation like this. So the best way is just to click the ones I'd say that you know for sure, and then go from there when it comes to picking the rest of the answers if you are unsure about the question. And then this one is a put it in order question. So the nurse exits a client's room who is on precautions. Order the steps the nurse should take when removing PPE. And this is the PPE, or these are the steps: removing hand hygiene, removing gloves, removing the mask, removing the shoe covers, and removing the gown. So when we're doffing PPE, it's really important to use this step-by-step process. So we always remove our gloves first, and then we remove our gown. Typically, you'll have your gown will go over your thumbs, and then you'll put your gloves over that. So you can take off kind of like your gown and gloves all in one go, but gloves will come first, always. Gloves, gown, then we do the mask. Once our hands do not have gloves on them anymore, then we can take our mask off. Then we'll go ahead and take off the shoe covers. And those are obviously going to be kind of dirty. So immediately after, we want to do our hand hygiene. So the steps for this is BECDA. Gloves, gown, mask, shoe covers, hand hygiene. And that is all the questions from the review tonight. Thank you guys so much for coming. Thank you for bearing with me. I'm sorry the chat wasn't working. I'm gonna work on that for the next session, and hopefully we can get that up and running. I'm gonna stick around for the next few minutes. If anybody has any questions or any recommendations or anything you want me to go over, just let me know. Thank you guys for coming. I hope you have a good night, and good luck on the test if I don't see you at the next review.
Thank you.
Thank you.
You're welcome, guys.
Thank you.
You're welcome.
When is the next review?
The next review is going